Welcome to the NIHR Newcastle Biomedical Research Centre. Our vision is to exploit our world-class experimental medicine in dementia, liver, musculoskeletal, neuromuscular, skin and oral disease to optimise health and healthcare in ageing and long-term conditions.
Over the past 10 years, NIHR has been absolutely tremendous in underpinning the partnership between the Newcastle Hospital's NHS Foundation Trust and Newcastle University.
The BRC has been pivotal in developing our international reputation in ageing and long-term conditions. And Newcastle is now a significant part of the national clinical research infrastructure provided by the NIHR. The last 10 years has seen a significant advancement, both in terms of our scientific understanding of ageing and long-term conditions, and also in creating a thriving research environment to study these conditions. This has been underpinned by state-of-the-art technology, clinical research facilities, and most importantly, extensive cohorts of committed patients keen to be involved in health research.
For me, it's absolutely brilliant. I meet some very clever people who are doing lots of research into topics that I find interesting because they affect me.
Our biomedical research building is now complete and is home to some of our most innovative clinical research.
Over the past 10 years, Newcastle's led the way internationally in translational research in the Lewy body dementias. Experimental medicine research is delivered through the NIHR Clinical Ageing Research Unit, together with biomarker facilities and access to one of the UK's largest banks of well-characterised brain tissue. Central to our progress in Lewy body dementia has been the acquisition of state-of-the-art technology like this PET MRI scanner, as well as our human movement laboratory. Our work's led to improved diagnostic criteria and as a consequence greater diagnostic accuracy, as well as to the development of new treatments.
The integration of basic science with clinical and research facilities within the Biomedical Research Building allows a multidisciplinary approach to assessment in our Cresta clinics.
The unique aspect of the Cresta Clinic is that it makes research normal, it makes it part of everyday clinical practice.
It's great to be able to come under one roof, see my consultant, have my bloods done, scans, everything else, and get involved in research. It's just brilliant.
Our recruitment into studies has increased vastly, and we are at the forefront of a therapeutic revolution in chronic liver disease. And a key example of this is the first therapy in primary biliary cholangitis in 20 years, which is about to be licensed by the FDA, and it came out of work that wouldn't have been possible without an environment that places research at the heart of what we do.
We have an international reputation in delivering to time and target early phase clinical trials and studies in rheumatoid arthritis and other conditions such as primary Sjögren's syndrome. Our recently completed bench-to-bedside tolerogenic dendritic cell study utilised our research design service, our NIHR clinical research facility, our GMP cell manufacturing facility, and also extensive imaging including arthroscopy.
I feel rejuvenated. Whatever I'm getting has given me my life back, really.
At Newcastle, we have substantial research capability and capacity in neuromuscular disease and mitochondrial dysfunction, and this is supported by the John Walton Muscular Dystrophy Research Centre and also the Wellcome Trust Centre for Mitochondrial Research. We're working really closely with patients and their families to develop new methods for accurate diagnosis and also treatments that will make major differences to the lives of patients. My research involves looking at the effect of mitochondrial dysfunction on the survival of neurons in Parkinson's disease, and the NIHR BRC has really helped to create a unique environment in order to support both my research and my developing research career.
Newcastle is an internationally recognised centre for skin and oral disease research. We have adapted cutting-edge techniques which we can use in human experimental studies, which will allow us to understand disease biology, but importantly drive forward the translation for patient benefit. Central to this innovation is the establishment of Newcastle University's single-cell unit, which will be underpinned by several core facilities: flow cytometry, high throughput and automation, genomics, bioimaging and informatics.
Through our outstanding people, research and NIHR-funded infrastructure here in Newcastle, we will be able to realise our vision and meet the needs of the growing number of people, both locally and further afield, who are living with the challenges of ageing and long-term conditions.